Good morning, everybody, and
Good morning.
welcome. Thanks for joining us. We've got a few more people still hopping on, so we're just going to wait a couple more minutes. Everybody. While we're waiting, I've got a poll that I'd like those of you who are here already to do for us. Katie, would you put up poll 1 for us, please? We're going to give it a couple more minutes and let people hop on. And while they're doing that, if you would all please answer the question in the poll. Just curious who we've got on the call this morning, what level of government your office represents, if you're a staffer, an aide, what legislative level is your boss from. We also have some folks on the call from AgeGuide from our committees and our board of directors. So welcome to all of you. Everybody can put an answer on the poll. We would appreciate knowing who's all here. Good, we're getting a good response rate. I'll give you another few seconds to fill out that poll if you haven't already. We're going to try to make this a little bit interactive today, so we're not just talking at you the whole time. Great. Okay, Katie, you can go ahead and close the poll. As you can see from the results, we've got quite a few people from the state level. We've got some local folks, some federal folks, and we've got a number of people from our AgeGuide board and committees. Thank you for answering the poll. It's good to start off and know who's on here. And I think we can go on to our next slide. I wanted you to see the agenda. Good morning, everybody. We're going to go ahead and get started here. Thank you for joining us today for the Legislative Aid Advocacy Kickoff, Building Connections in 2021. My name is Gretchen Knowlton. I'm the Manager of Planning, Advocacy, and Program Development at AgeGuide. This is our agenda for today. There will be time for questions and answers at the end, so feel free to either hang on to your questions or post them in the chat as we go along, and we'll try our best to get to them at the end. A couple of housekeeping items. Please put yourselves on mute. You will find the mute button up above your photo or down at the bottom. If you could also please put your cell phones on mute during the presentation, that would be helpful. And I also wanted to let you know that we are recording this event. And now it is my pleasure to introduce Marla Franczak, Chief Executive Officer of AgeGuide, Northeastern Illinois.
Thank you. Thank you, Gretchen. Good morning, everyone. I want to welcome you to AgeGuide's Legislative Aid Training. As Gretchen said, I'm Marla Franczak. I'm the Chief Executive Officer here at AgeGuide, Northeastern Illinois. And we're really doing this today because we know there's often a gap between the services available to support older adults and the public awareness of these services. During this pandemic, we've seen an even greater demand for services and supports. As you're aware, COVID-19 and its restrictions have disproportionately impacted older adults. And while these older adults are safer at home due to COVID-19, more time at home really can present challenges to them, such as social isolation, less access to nutritious meals, and most importantly, it increases the caregiver stress that these people are facing when they are caring for their loved ones. So we really want to take a lot of effort in helping everyone finding and connecting to resources so that these temporarily homebound older adults can have access to these essential services, because we know that they make an enormous difference in their safety and quality of life. So our purpose today is to give you an overview of the aging network of services in the collar counties to help older adults remain independent, engaged in their community. Currently, 1 in 5 residents of Illinois are 60 years and older. And according to the 2019 census, over 700,000 of these older adults reside in our 8-county region. So this brings an increased demand for those home and community-based services that provide things like financial, housing, health, and social supports, so all of our older adults can continue to age well and improve their well-being. In each of our counties, AgeGuide funds local agencies to provide Older American Act services like information and assistance, home delivered meals, transportation, caregiver support, and many other programs that you're going to hear about today. During this pandemic, our services have become a lifeline for the many older adults in the community. These supports are critical to helping older adults remain safe and healthy. And the pandemic has shown us that inadequate nutrition and social isolation can both be as lethal as the virus itself. So while keeping people at home was meant to protect the health of these older adults, the lack of connection with other people, community resources, and supports has posed a serious health risk, which I'm sure many of you are also kind of experiencing recently too. So to combat this, our Aging Network has efficiently and effectively responded to our new reality by both modifying our existing local service delivery and expanding programs for these older adults during this time. Our goal is to support the immediate and urgent needs of these older adults now so that they can remain in their homes. Due to the COVID-19 restrictions on public gatherings, many of these programs are being delivered virtually or by phone. But the really good news is it's working. And more than 85% of the people who are using our Older American Act funded services say that this assistance has helped them remain in their home and community. So we hope that after today, you'll be better informed about the needs of older adults, their families, and persons with disabilities so that you can connect your constituents to these essential services and supports as that they need to age well. So I'd like to turn it back over to Gretchen Milton, and I want to thank you for participating today.
Can't hear you.
Thank you. Thank you, Marla. I'm going to turn it right over to Leslie Edstrom.
Good morning, everybody. Katie, could you please pull up poll number 2? Okay, so again, we're asking for your participation on this poll, so we'll give you a few seconds to answer some of these questions, or the question we have up here now. Thank you for participating. It looks like we're getting a nice mix of people doing this, so please continue to participate. We'll just give it a few more seconds. Okay, so now we have our results, and it looks like we've got some people with some nice, solid, basic knowledge of AgeGuide and of the Area Agency on Aging and all the work that we do. We have an expert, and fortunately, we do not have anybody that's completely green, which is also very helpful for the presentation we'll be doing. So we can take that down if that works. I think we're good. Thanks for participating, everybody. So, like I said, we have those with a nice solid background on aging services. And what I'm going to do now is quickly provide an overview of the Older American Act services. As we discuss resources for older adults, it's important to start with some background on the Older Americans Act, as it is the foundation of the work that we do today. This act, which was passed by Congress in 1965, created the National Aging Network, which is a coordinated local network of essential services and supports that enable older adults to remain independent and engaged within their communities. It also provides funding to support caregivers. Most Older American Act services are available for anyone 16 older, regardless of income or assets, and caregivers age 18 and older who are caring for an older adult or caring for someone with dementia of any age. The Older Americans Act services target those who are 75 years of age and older, minorities, limited English-speaking persons, those who are older and live alone or in rural areas, and those with low income. The funding provided by the Older Americans Act for services is a combination of federal and state funds, but the funds only cover about 40 to 60% of the total costs for each program and service. So agencies that receive grants to provide these services must also secure local funding to supplement the programs. Next slide. Thank you. AgeGuide is one of 622 area agencies on aging throughout the United States and one of 13 in Illinois. Like I said, it was created in Congress to implement the Older Americans Act, and area agencies on aging coordinate a wide variety of services for persons 60 years of age and older. In 1974, the Illinois Department on Aging designated AgeGuide, Northeastern Illinois, as the area agency on aging for DuPage, Grundy, Kane, Kankakee, Kendall, Lake, McHenry, and Will counties. AgeGuide is a nonprofit organization that works closely with the Federal Administration on Community Living, or ACL, the Illinois Department on Aging, and many other agencies to address both the immediate and long-range needs of older adults. We are dedicated to advocating for increased services, benefits, and programs for older adults so they can age in place. One of our primary functions is to award funding to local agencies in each county to provide vital Older American Act services. AgeGuide then monitors these services through our region to ensure that they are high quality and that funds are spent appropriately. Next slide. As you know, we are part of an aging nation. By 2030, 1 in 5 adults will be 65 years of age or older. As this demographic shift occurs, there will be a corresponding increase in the need and demand for fiscal, health, and social supports to ensure a sound quality of life for millions of older Americans. On the local front, over 700,000 adults aged 60 and older live in our 8-county planning and service area as of the 2018 census. And the total is undoubtedly higher today. Roughly 25% of the state's 60-plus population live in our 8-county region. In fact, the largest population of older adults live in our region. And there has, as you can see from the slide, there has been an 82% increase in our region's 85-plus or oldest old population over the past 18 years, and an increase of older adults living alone. As the percentage of the aging population grows and lives longer, the percentage of people demanding multiple health services also grow. As a state, we need to prioritize improving care options, increasing the number of healthcare providers, and strengthening the service delivery system to meet the day-to-day needs of this growing aging population. Next slide, thank you. Home and community-based services are the most effective option for caring for older adults as they age. And fortunately, most people want to age in place in their home and in their community. As more Americans live longer and healthier lives, we need to adjust our public systems to ensure access for older people. Area agencies on aging support home and community-based services that are accessible, consumer-focused, and supportive, regardless of income or assets. Everything we're sharing today about resources and services is to drive our communities toward a new approach to aging services, one that revolves around home and community-based services, because research shows that overwhelmingly people describe aging well as being an integral part of their community. So why the focus on home and community-based services? To put it simply, people prefer it. A recent AARP study shows that 90% of older adults want to remain in their own home. This poses an increased demand on home and community-based services. Next slide. And it makes great financial sense. As you can see here, a U.S. Administration on Aging survey shows that for every dollar in federal funding for Older Americans Act services, this leverages an additional $3 in funding. So this return on investment is one of the ways home and community-based providers are able to do so much with limited resources. Supporting people as they age in their homes and communities prevents unnecessary health care costs and impoverishment. It creates a strong workforce to care for its aging residents, and it prevents millions in personal assets lost through elder abuse and financial exploitation. These programs mostly serve people in the community, and it is estimated that they cost about a third less than serving older adults in institutions. Slide 9, please. When an older adult or their caregiver receives community-based services, their health and longevity is improved. The impact of our services is reflected by the number of lives touched by our service providers in each of the counties we serve. In fiscal year 20, AgeGuide awarded over $15 million to local agencies that we contract with to provide these core services under the Older Americans Act. We advance our mission of empowering older adults to remain independent, connected, and to age well by funding the core services you see here in this screen. When an older adult or their caregiver receives community-based services, their health and longevity is improved. The impact of our services is reflected here. And I hope that you're seeing that community is where people want to live and the best quality of life for people. And now I would like to reintroduce Gretchen Knowlton to continue on with the challenges that we've faced because of COVID on our service design and delivery. Gretchen?
Thanks, Leslie. Katie, could you put up poll 3 for us? I've got another poll for all of you. I'd like to know how often your legislator or your office gets contacted by or about older adult constituents. Just trying to gauge what type of information will be most useful to you based on the kinds of phone calls and constituent questions you get. The poll should be up. Great. Good. Looks like a lot of you are responding that you frequently get calls about or from older adults. Good. I'll give it a couple more seconds. Get your answers in quickly, if you will, please. Okay. All right, looks like the majority of you are getting frequent calls from older adults. There's a couple of you who are getting calls only rarely, and we could talk about that too. Thanks for answering the poll. Here's our results. The information that we're going to provide here today will help you to direct those callers to the services that they need. But for those of you who are rarely getting calls from older adults, it may also help you to reach out to older adults in your community. For those of you, again, who maybe don't have as much information, a few of you said that you didn't have a ton of knowledge about older adults. This is one really good way to start connecting to the older adults, is to learn about the services that are available. And maybe when you do some of your outreach, you will know how to directly contact those older adults. So without further ado, first we're going to talk about the impacts of COVID on older adults. So I have to warn you that this first section of my presentation is a little bit depressing and dire, and I promise that eventually we will get to the good stuff about all of the exciting things that we are doing to address these challenges. But first, I need to kind of paint a picture for you of what has been going on for older adults in our community. I think it's safe to say that basically all of the challenges that we exist to help with as an area agency on aging became a bigger challenge with COVID. As of March 1st or March 11th of last year, it's almost coming up on a year here, all in-person programming that older adults relied on was suspended. Congregate services like the congregate dining sites and the senior centers all shut down, and they have yet to reopen. Health is the obvious challenge. We know that people are dying from COVID and that age is a risk factor in and of itself for hospitalizations and deaths due to the virus. In fact, 13 times higher chance of being hospitalized if you're over 85 than people in their 20s. That's 630 times higher chance of dying if you're over 85 than if you're in your 20s. Long-term care is also a crisis right now. It's very hard to contain respiratory illnesses in community living facilities. 70% of long-term long-term care facility outbreaks, and 75% of deaths in Illinois occurred in the greater Chicagoland area, including our region. Also, long-term care facilities in communities of color are disproportionately impacted. Social isolation is another challenge which can heighten already existing vulnerabilities like access to food, medication, medical care. We'll talk more about this on the next slide. I have a friend whose mother was in an independent living facility and she wasn't able to visit her mother in person after March of last year. And her mom's memory just got so much worse that by June, her mom didn't even recognize her when she called because she didn't have that physical or visual connection anymore. She was all alone in her room all the time with no stimulation. She ended up passing away and they never got to say goodbye in person. This is a very common story. There are so many tragic stories like this right now. Caregivers are also facing incredible challenges. There's a lack of respite. They're uncomfortable or not able to have someone come in the home to give them a break right now. A lot of families have moved loved ones out of long-term care back home in hopes of, not exposing them to the virus, but they're working from home. They don't have all of the supports in place that they would otherwise have. And adult day services are limited or closed right now. There's also a great need for nutrition, and we'll talk about this a little bit more in the next section. Technology. I'm sure that you've all heard the news stories about the challenges for older adults with technology right now. And according to a study that just came out last month by the Older Adults Technology Services, or OATS, they did the first quantifiable research study on the size and degree of the digital isolation crisis among seniors in the United States. They found that of the over 80% of COVID deaths in the US that have been older Americans, their research showed that about 40% of these folks were unable to access needed online resources because they lacked in-home internet. So think about that. That's very impactful and very sad. Black and Latino seniors are more than 2.5 and 3.3 times more likely, respectively, to be offline, to not have that internet connection. Grandparents raising grandchildren is another group that is struggling with technology right now. They're forced to manage e-learning. A lot of us know how challenging that can be, having our kids learning at home. These grandparents are struggling with the kids that they're caring for. PPE continues to be in short supply. We're now being told that one cloth mask may not be sufficient. There's new virus strains that are more transmissible. So PPE is even more important than ever. And finally, as you know, vaccine access is incredibly challenging, and we're definitely going to talk about that some more this morning. So I would like us to take a deeper dive into social isolation, which has always been a challenge for older adults. It's nothing new, but it has reached a crisis during the pandemic. Isolation is the experience of limited social connectedness, which is caused by a number of risk factors. It could be caused by living alone, maybe being low income, having mobility impairments, you're not able to get around and get out as easily, and even being a caretaker for someone else. So you can see how this is exacerbated by the pandemic as older adults have to stay home and isolate to stay safe. But it's really questionable what's more dangerous, being isolated or the virus itself. Researchers have found that loneliness is just as lethal as smoking 15 cigarettes a day. Sometimes I think we think of social isolation as only a psychological problem that causes depression and cognitive challenges, but it's also associated with higher incidence of health problems because isolation actually increases inflammation in the body, which can contribute to heart disease and other chronic health conditions. So this is a very complex and very significant problem, which is why it's a priority for us to address it. And we'll talk about ways that AgeGuide is doing that in a minute. I have a question for all of you. I would love it if you would please respond to this. Put your answer in the chat, and you can find the chat button down at the bottom of your screen. You can reply to all. How has your job changed during COVID? And if you're a new staffer, you're new to your job, how do you think it's different than it would have been without the pandemic? So if you don't mind just putting in the chat, what's some things that have changed for you personally in your life, in your job, in the role that you're doing as a result of the pandemic? Working entirely remotely. Yes. I mean, just the fact that you're all sitting here with us on a Zoom call instead of in our lovely conference room at AgeGuide in Lombard is one example of that. Rarely in the office. Yes, I can relate to that. Spending 24/7 with a spouse. Yes. We're all kind of stuck together and torn apart at the same time, aren't we? And unable to have face-to-face visits. Yes, that has been very challenging for all of us. We normally do a lot more face-to-face visits with our clients. And now we're doing more things over the phone. There's not as much socialization. That water cooler chat with coworkers isn't there, right? We have to count on our pets more. Yes. I appreciate all of these comments. They definitely resonate. Connecting with people remotely is a whole new thing. Everybody's mentioning that whole remote piece. Thank you. Thank you very much. Oh, and we've got kids at home, kids doing e-learning, toddlers running around the house. Yes. So we're all experiencing this pandemic in different ways, but also in very similar ways. So just keep thinking about how challenging this has been for you. And then try to imagine what it's like for older adults who are stressed about the health risks, maybe never used a tablet or a computer, were cut off from loved ones and friends. As soon as everything shut down, AgeGuide really turned on a dime in order to guide our funded partners through that process of turning everything virtual, like you guys have discussed as well. The needs of older adults were not only still there, but they were exacerbated, and we needed to figure out how to continue to support older adults in entirely new ways. We had to completely reimagine our programs. As some of you mentioned in the chat, we've all begun using technology and done things virtually. We started using this thing called Zoom, which whoever heard of that about a year ago? We needed to get our older adults comfortable using this and doing more things via phone and email and online. This was especially important for the senior centers who have been critical to providing that social outlet for older adults. So at AgeGuide, we developed a template to help older adults connect with our programs and with other people virtually through Zoom, FaceTime, Facebook Live, all those other platforms that we're all learning how to use. We've also worked really hard at staying connected to our aging network. So we created a listserv to help our funded partners stay connected, and we meet monthly with them to help troubleshoot and stay up to date on everything going on around the region. So when you refer people to a local aging provider, you can trust that we are all working really hard to provide the most up-to-date and relevant resources and information for older adults. If you need something for constituents, please call us or call our funded partners. We'll be sending out a list after this call of the service providers in each county, so you will know exactly who to connect to. I have another poll for you. Katie, could you put up poll 4? I'd like to know how often you're getting calls about older adults who need food, who have challenges meeting their nutritional needs, or who are asking for food. If you don't mind filling that in, I would appreciate it. We'll just take a couple of seconds just to get a sense of that. Got more than half of you in. I'll give you a couple more seconds. I see if people are still responding. Okay, Katie, you want to close it? Let's take a look. Thank you. All right. So not too many of you are getting frequent calls about food. That's good. But a lot of you are getting occasional calls, and some of you are rarely getting calls about that. That's interesting. It's not surprising. But as you can see from this slide, we can take down the poll. Our network of nutrition providers really ramped up our meals since March when the pandemic started, and we've seen an almost 60% increased need for meals. We also modified how we distributed meals to accommodate the new reality. Just so you know, if any of you do get any calls about this, or if you know any older adults in your family or in your community who need food or can't cook or can't get out to shop, we've got meals for them through our funded partners. The home delivered meals contacts will be on that those flyers that we'll be sending out after the call that have all the providers on it. So you'll know exactly who to connect people with. Keep in mind that our providers were increasing these services while navigating COVID-19 protocols with staff and volunteers, many of whom themselves were in the high-risk age group. So from March to September, the network provided a total of over 877,000 meals to almost 11,000 people in our region. Of these meals, most were delivered directly to homes, but thousands were also picked up at designated locations from those seniors who still like to get out and drive. There were also shelf-stable meals that were provided for emergency use. So I'm wondering if perhaps the fact that a lot of you were not getting a lot of calls about these meals mean that folks are getting connected, and that's why we've seen such a huge leap in the need for these meals, and we've been able to address it. So you're not getting a lot of concerned people who can't find it. That's a good sign that people know where to go to get these meals. But this graphic does show how significant that leap has been. The green line is the number of people, and the bars show the number of meals that were provided. So you can see that that startling upward turn. Federal and state support for these programs during COVID has been a lifeline for the Aging Network in responding to COVID. First of all, older adults were recognized right away as a high risk due to their need for assistance in receiving food while everybody was sheltering in place. And as a result, anyone over 60 is considered homebound and eligible for home delivered meals. So that's something else you need to know. Anyone over 60 is considered homebound right now. So everybody is eligible if they need it. Shelf-stable meals were provided to both home delivered and takeout clients to help prepare for emergencies. We had flexibility in our nutrition guidelines that let us quickly secure several takeout meal sites at restaurants and banquet halls. So it was a real nice collaboration. And back beginning next month in March, when the weather breaks, hopefully, takeout meals will once again be offered for anyone who would have gone to congregate dining sites, which will remain closed, but they'll be able to pick up meals there. And we've heard about seniors meeting in the parking lot, socially distancing, seeing their friends when they pick up their meals. So it's still sort of a social event for them and very important for them. Thanks to the Consolidated Appropriations Act funding, we'll be able to maintain this current increased capacity to provide meals to our region going forward. Now we're going to shift gears and talk about the many services and supports available through AgeGuide and our funded partners to reduce that social isolation in the midst of the pandemic. Social isolation was recognized as a health crisis and a statewide initiative even before the pandemic began. Reducing social isolation continues to be a priority for the Department on Aging state plan and also for the state legislature, as evidenced by the budget, including funding to help address this issue. Since the pandemic began, AgeGuide has ramped up social isolation special projects to make sure that there's projects that address this challenge in every one of our 8 counties. Some of these projects are new, while others are an expansion of existing services. We are working in collaboration with other community-based providers to offer virtual services that address this challenge of social isolation. So we've got some county-specific projects, which is friendly visiting and telephone reassurance. Every county has one of those. You can see the list of region-wide interventions on the screen. These are available in every one of our counties. In addition to preventing loneliness and isolation with other community-based services, resources, and activities, these are things that anyone can access who is interested. We've got evidence-based health promotion classes like Matter of Balance, Bingo Size, which is very popular, Stress Busting, which is very helpful for family caregivers. These have all gone virtual. And our music programs and memory cafes are a ton of fun, and I would encourage you to direct people to these if they need an outlet for socialization. We've also have an interesting partnership with T-Mobile to provide tablets, technology training, and internet access to hundreds of older adults. We developed our own guide for people on how to use the tablets. And then once we get many of our older adults using the technology, we're able to get them connected to the senior center virtual activities and other offerings in the community. We've also been working on long-term care advocacy to address some of those issues that I talked about earlier. We're encouraging facilities to use technology to accommodate virtual visits with relatives. We've also been able to distribute PPE to our ombudsman, our long-term care ombudsman program, and adult protective services. And we gave out goodie bags to all of the home delivered meal clients that had masks and gloves and information in it. So we've also begun to offer some online learning opportunities directly at AgeGuide through a platform called Get Set Up. It's an online social and learning community that's designed specifically for older adults, and there's classes available around the clock on like just about every topic imaginable. I've seen things on how to use Facebook, to wine appreciation, line dancing. They've got something for everyone. And then there's tailored care or T-care, which is addressing the needs of family caregivers. We've partnered with this project to strengthen the capacity of our providers to support family caregivers who are struggling right now. We know that this is a very challenging time because they're isolated, they don't have the same supports and resources. And they're really overwhelmed, is what we're hearing. So, the Family Caregiver Support Program provides valuable resources for those who are giving unpaid care to an adult 60 and over, or someone with Alzheimer's disease or dementia, or anyone who is over 60 who is providing care to someone with a disability. I have one more poll for you. Katie, could you put up poll 5, please? I'm wondering if you have been getting a lot of calls about how to access the vaccine. I'm seeing a lot of being inundated by these calls. Wow. Okay. And a couple of you are just getting a few calls, but looking like we're seeing a lot. I'll give you a few more minutes to respond, a few more seconds to respond. Then Katie, you can close the poll. Let's see what we're looking at. Okay, only one of you has not been getting calls. A few of you are getting some calls, but most of you, 80% of you, are inundated. And I feel your pain definitely here at AgeGuide. We are being inundated as well. Our funded partners are being inundated. Thank you, Katie. Just the other day, our funded partner in Will County told us that they're fielding about 2,000 calls about the vaccine on Mondays and about 1,500 every other day of the week. That's a huge ramp up. We've needed to coordinate community resources to assist the health departments and our funded partners in managing this volume of calls coming in. As you know, the vaccine isn't widely available, so it's competitive and it's challenging for older adults, especially because a lot of vaccine appointments are still only available through online methods. And that's true for the overwhelming majority of pharmacies, especially. Some of the health departments have got call centers. Our funded partners are available to take calls, but some of those other resources for the vaccine are still, you've got to be able to go online and do it. And for those people who don't type fast or don't understand the technology, it's a nightmare trying to snag those limited appointments that are available. In fact, an estimated 42% of our Americans who are over 65 don't even have a wired broadband internet connection at home. So we have really set up a system that is not working for our older adults. And AgeGuide and our funded partners are trying to step into that gap and help with that. We heard one story about an older adult who had 8 adult children and grandchildren online at the same time, trying to snag her a single vaccine appointment when they had heard that there was some availability. And even with those 8 tech-savvy adults on tablets, they weren't able to get their mother, grandma an appointment. So that just shows how challenging this can be. And then when the older adults do get an appointment, they may have transportation challenges in getting to the site. And that's something else that we're going to talk about. Thankfully, the area agencies just received a COVID vaccine assistance allocation from the Department on Aging. So we will have about $235,000 to help with vaccine outreach in our region. And this is going to allow us to help assist with scheduling those vaccines, coordinating the transportation to and from the vaccine, and it allow us to record and keep track of all the various vaccine efforts that are going on in the region so that we can spot needs and gaps quickly and try to address them. Equity is a big issue, as I'm sure you've heard, that Black and Brown populations are not only harder hit by the virus, but they have a harder time getting a vaccine due to the digital divide, issues with broadband access across our communities, and transportation challenges. So we're going to be targeting these populations, especially in order to get resources into those underserved areas and help people to get their vaccine. This slide describes our role in vaccine outreach. We've created a COVID-19 resource website landing page that includes county by county information on vaccine registries, call-in centers, because every county is doing things very differently. As I'm sure you know, those of you whose districts span across county lines, you have to figure out what is going on in each county, and it also seems to be changing regularly. So we're updating that frequently. We also have the latest CDC and Department of Public Health COVID information on our website. It's a great resource for you. You can check that out. We're also sharing COVID resources through all of our communication channels, our newsletters, emailing, social media. We are collaborating very closely with the health departments in each county and with our local partners. We've been helping make that connection between our partners and the county health departments and medical clinics, having regular meetings with each health department to determine the points of collaboration, like how we can help connecting the older adults to these ever-changing protocols for the vaccine. We're also going to be helping the especially challenged populations, those who lack technology, skill, and are homebound to register for the vaccine. So AgeGuide staff will provide some direct registration in some of our counties. So when we get a caller, we'll be able to go right in and make them an appointment instead of referring them somewhere else. And we know that health departments are working with senior residences, and they're doing some drive-throughs as well as walk-in clinics. One hard to reach population, though, is the homebound seniors. And we're working with our health departments to reach these people because AgeGuide and our funded providers are already connected to these folks through our home delivered meal partners. So we know where these homebound seniors are, and we can reach out to them and get them connected as soon as there's vaccine availability. So again, the outreach is really going to have to come once there's enough vaccines. And we'll be able to help target seniors, especially in those underserved demographic groups. Our funded partners are the trusted advisors in the community. So they're well positioned to get people connected and also to dispel some of the stress and the concern that folks have and make sure that people are not getting scammed. There's a lot of scams out there around the vaccine. There's a lot of myths about whether the vaccine is safe enough or not. So our funded partners are doing a lot of work around that in terms of outreach as well. And then transportation, we're supporting regional transportation efforts through existing transportation programs, as well as ramping up some new transportation options. We're exploring some partnerships with limousine companies that have town cars that are not doing anything right now because there's no events out there, nobody's traveling to the airport. So those are available also to help pick people up and take them to their appointments and bring them back again safely. That's something that we're working on as well. We have found that there is so much confusion and there wasn't a real simple, consistent message for older adults about how to navigate this whole vaccine registry process. So we spoke to each health department to find out the protocols in that county. And we created one-page flyers for each of our counties that give a simple list of the 4 things that older adults need to do. So if you're hearing from older adults with questions, here are some good messaging that you can use, and all the links and numbers that you need for each county are on our website. But basically, we need everybody to sign up on the health department's registry. We need everyone to create an account on the pharmacy websites and keep checking for availability. We're giving out the number that they need to call if they don't have internet. And finally, we're telling them once they've done these things, they just need to be patient and wait, and someone will be calling them to schedule from the health department registry if they can't find a vaccine elsewhere. And then just keep following the 3 Ws. You know, that's really the main message that they need to hear right now. They need to know that they've done the right things, they've done what they need to do, and then they just need to be patient, be kind, be ready. That's our messaging that we're using on these flyers. And so far, it's been very helpful and very well received. So we'll be sharing these with our home delivered meal clients and sending them out with any mailers that are going out from funded partners. We'll also be getting these out on our websites. We're just finalizing them and checking all of the details with each health department to make sure we have the right information on them. So now if you would go down to the bottom of your screen and in the reactions, under the reactions button, raise your hand if you or someone from your office attended one or more of our community listening sessions. I'm curious who had attended our public community listening sessions, if anyone did at all. Like I'm seeing maybe one. Katie, are you seeing any hands raised? Nope, I don't think that many of you had the privilege. Yep, I don't see hands raised. So I'm guessing that not many of you had the privilege of attending our community needs assessments. Oh, there's a couple of, well, a lot of our AgeGuide board members were great partners for us on that, and we appreciated having them involved in that. So I'll tell you a little bit about it since a lot of you were not able to join us for that. We do a community needs assessment as part of our area plan every 3 years. And part of that process is to do this needs assessment in our 8-county region. It's AgeGuide's priority always to apply a diversity, equity, and inclusion lens to everything that we're doing. So we also looked at our needs assessment through this lens of inclusivity to examine how our diverse communities of older adults are doing and what they need. So we consulted with another area agency, actually in Portland, Oregon, who had an award-winning method for capturing the input of communities of color in their needs assessment, and we borrowed from their methodology. And we designed our questions, our listening sessions, and our surveys with this lens in place. We ended up doing 25 community listening sessions. We had 250 participants. We spent about 36 hours listening to the community, and we got wonderful feedback and input. We're still compiling all the data. We got so much good stuff. We're going to be compiling it for the next few weeks, and then we'll have some results for everybody. But we also put out a survey for those who weren't as comfortable or didn't have internet capability, because of course, all of our listening sessions had to be virtual this year. Normally, we would have done them in communities around our region, and we would have sat down in person and served some breakfast. But of course, this year they were all virtual. So we did this survey for those who didn't have that capability or who weren't comfortable or wanted to give a little bit more of a personalized input to us. So we captured over 460 participants with our survey, and 80% of those were older adults. Almost 30% of them were living alone, and 90% of the survey respondents were new responses. So we had people who had not attended listening session. So all in all, we got input from well over 700 people. The preliminary results are on the slide here. Like I said, we're still analyzing all of that data, and we left the survey open a little bit longer to capture some of our English, limited English speaking participants. So we're still getting some results from them, but the survey was closing today, and then we'll be culling through the data. But you guys are lucky in that you get this sneak peek. No one else has seen this data yet. You're the first ones to see it. We haven't publicized it yet, but you'll notice these 3 things really rose to the top in all of our conversations. And these are also things that we've been talking about, that we've been trying to address already. But these will continue to guide our work into the next 3 years: technology, language and cultural barriers, and of course, dealing with COVID-19. Now that we've talked about our needs assessment and all of our challenges and all of the things that we've been able to put in place, we wanted to share with you our legislative priorities and the things that you'll be hearing from the Aging Network this year. On the federal level, we want to strengthen caregiver support through funding for family caregiver programs. We also want funding for essential services during COVID to address that food insecurity and the social isolation specifically, those two big crises that we talked about. And finally, we need legislators to prioritize and support the aging community in the vaccine rollout and outreach. We don't want our older adults left behind. At the state level, we're asking for support for long-term care facilities. They need staffing, PPE, testing, and vaccines. We need to fund the Illinois Family Caregiver Act. Representative Willis introduced House Bill 293, which provides funding for the Illinois Family Caregiver Act, which was passed in 2004, but has never been funded. So we need funding for that, and we're supporting that House bill. We also need legislators, again, to prioritize and support the aging community in the vaccine rollout and outreach. We feel like they have gotten left behind. We really need our legislators to step up and to speak for us in Springfield and in Washington. Before I turn it over to Leslie, I have one more question for you. If you could just raise your hand using the reaction button again, if you are planning to attend one of our advocacy collaboratives in March. Put your hand up. I hope that some of you have. And if this is the first time you're hearing about it, Leslie is going to tell you a little bit more about it. I don't see any hands up. So Leslie, it looks like, oh, maybe we've got three people. Three people are planning on it.
There's a few hands up.
A few hands. Okay, well, Leslie, this is your opportunity to drum up some excitement about these events. I think everybody is going to want to join us.
Great, thank you, Gretchen, and thank you to those who have joined us in the past for these events. And for those of you that have attended these advocacy breakfast collaboratives in recent years, we appreciate your support. This year, AgeGuide is hosting virtual advocacy collaboratives, unfortunately without the bacon, but still with our great partner, AARP. These events have been widely attended by elected officials, aging network providers, and concerned citizens. This year's agenda will address issues facing older adults and their families, including promoting COVID vaccine education and access of vaccinations for older adults, reducing social isolation among older adults, especially during the pandemic, and building support to fund the Illinois Family Caregiver Act. We currently have Dr. Tokars from the Illinois Department of Public Health speaking at the Lake and McHenry County event, and Michael Isaacson from the Kane County Health Department speaking at the DuPage Kane event, in addition to our local funded partners who provide direct services for older adults. And we hope that you have registered to join us at these events. The agenda is the same at all of them. So if you're unable to attend one, you can feel free to attend another one because our agenda, like I mentioned, is very much what we've been discussing with you today. You can sign up on our webpage, and after this meeting, we'll also be sending out the invitation again with the links to register. So be looking for that in your emails. Thank you for this opportunity to be able to share the information on the advocacy collaboratives with all of you.
Thanks, Leslie. And that is something that we're encouraging the legislators themselves to attend, because usually at the end, there's some time for them to say a few words, and the older adults and the attendees love to hear from the legislators at these events. That's one of the big draws. So I would encourage you to talk to your legislator to schedule some time. We've tried to schedule these on days when they're not in session. I know other things still come up, but if you can get them registered for one of these, that would be wonderful. And we just have a couple minutes
I do want to
left.
add, thank you for reminding me. Gretchen, I'm sorry. I just wanted to add, if for the legislators that attend, we've always allowed them an opportunity to speak on the items that we're talking about in our agenda, about how they're working to help with those initiatives that we're working on or the issues that we're facing. So that again will be happening this year. So it's really helpful for us to know who is attending so we can be sure to introduce them and make sure we give them the time and the ability to speak during the collaborative. Thank you.
Yes, good point. Thanks, Leslie. So we just have a couple minutes left. I'm sorry we've filled up your time, but if there are some questions.
There are a couple questions
ahead,
in
Katie.
the chat, Gretchen.
Thank you.
One of the questions is, will the slides be made available after
Yes,
today's meeting?
we will be happy to share the slides with you, and feel free to use the slides, share them with your community when you're doing presentations. We appreciate you getting the information out and helping us spread the message however we can.
And that was the second question. They just wanted to make sure that they could share the slides
Yes.
in their own presentations, of course, giving credit to the agency.
Thank you. Yes, we would be grateful for you to share the slides and the information that was presented today. Feel free to unmute yourselves and speak up if you have a question about anything that was presented as well. I know it was a lot.
And that's it for the chat, Gretchen.
Thank you.
I have a question.
Yes.
This is Paula Jensen, and I represent McHenry County Board, the 5th District, and I'm also on AgeGuide board.
Hi, Paula.
Good morning. What we're having is a problem with coordination with Public Health Department and the private companies such as Walgreens, CVS, Meyer are just a few of the vaccine and the administering of the vaccine. Our Public Health Department at the last county board meeting reported that they are planning or are planning 900 seniors per week for vaccination. Well, I've done the math. It will take 6 years to complete that task. So my question is there a place, a hub where we can get the base number of vaccines that are being administered in our county between what Walgreens, Costco, et cetera, and the Public Health Department to get an idea of what that coverage is and what they plan, what the future plan is. And it seems like there's a lack of coordination. I sound negative, but I don't mean to, but all the calls I'm getting are very upset, anxiety ridden older adults.
Yes, we're hearing the same thing, Paula. Go ahead, Leslie, you were going to answer that.
We've been, Marla and I have been in conversations and along with Mickey Miller on what's going on in McHenry County, and it's echoed in all of our counties. The health departments, the local health departments are not getting information. They keep getting told that they're going to be told the supply that they're going to be getting to the health departments every like a 3-week about amount of information about what the distribution will look like for the next 3 weeks. But what they're doing, what they've been getting is just a weekly amount that has been supplied. They also, as you mentioned, there are also direct shipments that are going in some cases to hospitals or to pharmacies. And that information is shared with the local health departments at the discretion of the pharmacy or the hospital. It's not necessary, you know, they're working very diligently with these community partnerships to get information on that. Some of our counties are getting direct shipments, others are not. I believe when we were working with McHenry County, I will say this about McHenry County, they have a call center to really address the needs of older adults. Those people can call in and get information and get help with registering. That's not something.
I'm going to dispute this. Because I'm sorry, but the call center does not have enough people taking the calls and they don't have enough lines. So what I'm saying to you is what I said at the county board meeting. They need to ramp it up, have more people taking those calls. Seniors are feeling very frustrated because they can't get in, the call drops, or there are no return phone calls. There's not a capability to leave messages on voicemail. Now, I've had a conversation with Scott Block at the Mental Health Board. They're thinking about offering some additional room space, and there's a movement underway to expand the number of people to take those calls. But at this point in time, Leslie, the demand exceeds the capacity of that call center. And so I'm getting calls where they're upset, you know, with my county system to adequately address the needs of people calling in. So there, in the future, there will be expansion of this.
And I would say that
Time.
that's not unusual across the counties, unfortunately. I mean, the fact is they rolled out the information that, hey, we have these vaccines, but as we discussed, there are so many barriers to getting them. And not only that, but there's not enough vaccines. So it's creating a lot of anxiety. And then, and there's no, until we get more vaccines and more manpower, as you said, we're in a really difficult position, all of us. And that's what this new outreach grant, this new COVID vaccine outreach grant is going to hopefully, well, it will help us even unify more. And we're continuing, we're learning as we go as fast as we can about how to collaborate better and get this consistent messaging. And I think that's the goal that AgeGuide is really working on, is to provide consistent messaging per county. Like we know, every county is doing this differently. So we're really striving to help our counties communicate what the steps are and how to access vaccines when they become available, or I should say, as they become available. I know it's very difficult.
Thank you. I do see that we have a hand up from Haley Edwards from Representative Hernandez's office. Haley, do you want to unmute yourself and ask your question?
Sorry, I think I just didn't put my hand down.
That's okay.
When you asked everyone to raise their hands earlier.
No problem, no problem. Any other questions out there from anyone else? Okay, well.
I have a question.
Yeah.
This is Fabi from State Rep Dan Didich's office. I wanted to know if anyone has reached out to the pharmacies in general to see what they can do to make their portals more senior friendly.
Leslie, you want to take that?
Sure. Thank you for that question. It's a great one. To make those portals more senior friendly. What a concept. We would all love to see that. And we know that people that are not even older adults are stumbling around in these sites. And I do mean stumbling around. And we know of a lady who's been working at this diligently in DuPage County because her mom and dad needed to get vaccinated. And she figured out after hours how to navigate the Walgreens pharmacy, creating the account and then finding COVID on there, the COVID vaccine on there, and then taught her neighbors and friends how to do it. But that's like grassroots efforts of people figuring it out, cracking the code, if you will, and then sharing it. But that's not helpful for our older adults. But and I agree that is absolutely something that needs to be addressed. And we're going to keep talking about it with our.
Can I? This is Cheryl. Can I jump in here for a second? From the board. I found a way. I just got my vaccine, and it was by luck of a choice, by chance. But I found a way and this is how I've been trying to help some of the seniors too, is that there's an extra dose in every vial. And so what I did is by contacting Jewel Osco, and I was going through all the Jewel Osco's pharmacies. And at the end of the day, I contacted the pharmacist, the head pharmacist, and I asked him if there is an extra dose at the end of the day, at the end of your appointments, because there is no appointments, is there a possibility that I could come in and get that extra dose? And he said, because there is an extra dose of in the vial that they have to get rid of because they don't want to lose it. And he said, yes. And I said, what is your last appointment of the day? And he said, it's 6 o'clock. Why don't you come on in? And it was in Aurora. And so on Tuesday, my husband and I came in and we ended up getting those dosages. And we got our vaccine, our first vaccine. And so I was trying to tell him, I said, well, this is a way that the seniors and what, we could get them in is if there is at the end of the day, and I know, and I was trying to help with our DuPage County, some of our people that are, helping making these appointments for our seniors is that if we're scheduling appointments, if we're calling these pharmacists, and at the end of the day, if we can, we're getting them, the appointment, if we could call and say, at the end of the day, if you have these extra dosages, what time, and can we bring these seniors in? And we work with these pharmacies by, you know, if they, because some of these appointments do not show, they do have extra dosages in the Pfizer, you know, vials. We set something possibly up with the management of these duals. Maybe we could do it that way.
Yes, thank you. It's unfortunate that you have to find a way to work the system, because I think that is
I hate to say
difficult
it.
for some seniors. I mean, we've heard
Right.
stories of seniors parking outside of Walgreens at the end of the day and waiting to see if there's extra vials. We really don't want older adults out in this kind of weather waiting in
No.
their cars for extra vaccines. I mean, that is absolutely unacceptable. So we are working very hard to try to figure out how to make these things run more smoothly and trying to partner with folks. Fabi, were you going to add something else?
Yes, can you hear me?
Yes.
Oh, I had a follow-up to that, pressing on, since pharmacies are getting doses, I believe, from the federal level, is there any stipulation that these pharmacies can implement a call-in number as an option to register or to schedule yourself for vaccine? Since I deal with Lake County Health Department in suburban Cook County, and they have call numbers, they have an email set up where seniors can at least leave a message or you know, send an email if they have access to the internet. If they don't, they can leave a message. But it seems like a lot of these businesses, pharmacies that are getting the vaccine directly don't make it very easy for the senior population.
Yes, you're right. And that's a really good point. They're getting the federal dosage. They should be playing nice. I totally agree with you. And perhaps that's something that those of you on this call can take up to your bosses and to the legislators if there's anything that can be done about these pharmacies making their websites more accessible, getting a call-in number so that older adults can make these appointments. It's not working for older adults right now. You're completely right. That's a real problem. So we appreciate your help on this as well.
Mm-hmm. And what about these extra dosages that they don't promote, that they have every day in these vials? What about setting up these seniors for these on a scheduled time for those extra dosages?
Right. That would be something that our funded partners could totally help with. They could get those out to seniors, no problem, if they could find out about them. Right. So that's another question. I sure hope those aren't just going to waste in some instances. And I think that's really at the policy level. That something needs to be done about that. So again, we appreciate your help in this if there's anything you can do. Great discussion, though. I really appreciate your thoughts and your feedback on this. Any other questions out there before we let you go? I know the hour is late and we've kept you over, but we have really appreciated your time. Thank you all so much for joining us. And please check out our website, www.ageguide.org. We've got tons of resources on there for you. Sign up for our newsletters and check out our blog posts and follow us on social media. This concludes our resource presentation, and we hope that you found the information useful, and we will be sending you some goodies afterwards, like the PowerPoint and those promised county resource sheets. Thank you, and have a great day.
Thank you, everyone. Thanks for coming.